Dr. Dionne Ross, welcome to the show.
Thank you. It's a pleasure to be here.
So, congratulations on the new practice. When did you open your practice?
New Year's Day.
New Year's Day. Wow. Okay. And it's face-to-face pediatric care in Albuquerque, New Mexico.
Correct.
How long have you been in Albuquerque?
2 years, actually.
2 years. Okay.
Yeah.
So you went from the corporate world of medicine, to taking the plunge into direct primary care. Was there a snap out of it moment when you said enough is enough, or was it just like over time I said, okay, I got to get out?
Yeah. When I first started, I just always knew that I was missing something. I felt like I wasn't doing everything that I was trained to do, and I wasn't doing it the way I would like to do it. And so it took me a couple of years to settle in and be okay with it. And then I just kept increasingly becoming more and more unhappy. Even though I love my job, I love practicing medicine, but I became unhappy with the way I was practicing it and all the things I had to do, all the paperwork and all the issues with the insurance companies that I had to deal with, that it just became a little bit more frustrating. And about 2 years ago, I felt like, well, everybody says this is kind of the way it is. So I thought I had to change my profession. I thought I had to move away from outpatient pediatrics and try and find a different avenue in pediatrics to be happy. Or I had to invent something myself. And so I started doing that. I started searching. And then we made the move from San Antonio to Albuquerque. And I went back into corporate medicine, but in a different way. And I became a pediatric hospitalist. And I enjoyed it there too, but still felt like I still needed to do this differently. And then COVID-19 hit. And that was the moment. That was the moment when I realized patients are not getting seen because they're scared. Kids are scared. Parents are scared to come to the doctor's office. And I knew that what I had in my mind was something that they would benefit from. And so when I lost my job in corporate medicine, that was the moment when I said, okay, this is my time to do what I want to do. But I always thought I had to invent it myself. I did not know it was already there. And so I was so happy that I found this strong network of DPC doctors, and I've just taken off from them.
It's a great support group, isn't it?
Very good, yes.
So tell us for a moment the type of care that you're providing, because face-to-face indicates a lot more of the hands-on approach. Obviously, COVID-19 is a bit of I won't say a hiccup, but it is a big detour around what you normally do. But I've read where you do home care. So the face-to-face really is face-to-face, like you're going to the home at some point. How is this working out for you?
Right now, it's working out really, really well. And so I offer in-home visits and virtual visits. And parents love it for a number of reasons. My practice brings kids closer to me. And in turn, I'm closer to them when I get to see them in their own environment. They're so much more comfortable. They're more honest. They're more open. And they just love having their doctor at their home. Parents love it because They don't have to pile all the kids up in the car and take them to the doctor's office. Um, Parents of newborns like it a whole lot because let's just face it, newborns just don't quite work on our time, right? They nap just when you need to get out of the house. They want to be fed just when you're supposed to get there. And so many times you're never on time for anything. And so they love the fact that I get to come to their home and I get to have virtual visits, whether it's over a video call or a phone call. I get to have those kind of visits with them at their convenience, and they're still comfortable. And they enjoy the fact that I get to offer them 30-minute to 60-minute appointments, even longer if necessary. So for example, this morning I just had a newborn appointment and I actually spent 2 hours in their home with them.
Wow.
I mean, that does not happen in traditional medicine. That can't happen in traditional medicine.
That's
And
laughable. The thought is laughable. Yeah. No.
I mean, I got the time to really sit there, answer all their questions. And newborn parents they just have a lot of questions and they need us to be there for them. They need to know that what they're doing is right. They need to know that they can do this, that they can care for a brand new baby and that they're not hurting their baby. And so we answered all their questions, did a full exam. I even went into the nursery and looked at everything for them, gave them great tips, told them what's a good idea, what's not a good idea. They loved it. And when I left there, they were so much more calm and relaxed and just happy to have me there. And so that's what my practice also offers. You know, I really just enjoy being there for the parents and seeing them in their own environment as well. And in addition to your typical well child visits and sick visits, I also offer vaccinations. I also offer lactation consultations because I am a certified lactation consultant. And I do sleep counseling, nutrition counseling, fitness counseling too. I'm a big advocate for keeping kids healthy by keeping them active. And I don't only talk about it with them, I get involved with them because I love to work out. I love to train. I love to keep myself active. And so I like being there in their home. Sometimes I'll do a dance workout with some of the kids, or I'll go play basketball with one of them, or, just get active. We'll go for a run. I have a few programs coming up where the kids get to go on a bike ride with Dr. Ross. They get to go on a run with Dr. Ross. So I enjoy that part of it.
Wow. I bet that's pretty impressive when the parents are taking video. There's our doctor playing basketball with our kids.
Yes, very unusual, but they love it.
So there's an important point here aside from the convenience, and that is the fact that you're in their space. You get to see how they live. And that, from your perspective, how important is that? And what are some of the things that you pick up from that?
So some of the things that I notice, it varies by age group. So typically your toddlers, if they come into a clinic or into an office, they're not as open, they're not as chatty. It's very difficult to determine their developmental status that way. But when I get to be in their home, I get to see their interactions with their family members. And I get to identify language issues or communication and social issues way easier than I would if I was in a typical traditional office. As they get a little bit older, your 6, 7, 8-year-olds, they face a lot of difficult situations in school and they're not always as open with their parents about it. But when they're in the comfort of their own home, I find out about bullying. I find out about other unfortunate situations, sometimes even abuse. And we know right now, because of COVID-19 and because of the pandemic, a lot of children are not dealing with this well. And so depression, anxiety, even suicidal thoughts and ideas, they are way more open to talk about it in their homes than they ever would be in an office. And when they get to know me, when they get to see that I'm here for them, I'm coming to you, I'm meeting you at your comfort place, they're way more generous with their information to me. And parents love it because they're usually the last to know about these things. And I get to find out about it early and deal with it early. And as they get older, even older, they open up a little bit more about their sexuality and, just general concerns about their bodies. And then usually in the office, they're a little bit more timid to talk about it. But I have not had a patient so far feel like I've been invading their space or invading their privacy. They're just happy that I'm there. And it shows that I care a little bit more about them than if I was still in the office.
There's something that you're bringing up that for the parents, and there's a quote that I've heard, and there's no price for having peace of mind when it comes to your kids. And part of that is there are known unknowns, and then you have unknown unknowns. And part of what you do is really taking the known unknowns and making them known knowns,
Right.
to put it somewhat poetically. That's really, for the price of a monthly membership, it's sort of a no-brainer for a parent, because you're taking a lot of what is otherwise a very stressful and call it a suppressive influence over them. The fact that they're either new parents or just parenting in general. And you're reducing the stress and anxiety levels down because they have access. What's your experience? I mean, you mentioned the 2-hour visit this morning. Are there any other examples you can give of maybe a parent of a 4 or 5-year-old that's dealing with something in pre-kindergarten? Anything come to mind?
Yeah, actually have just a slightly older, a 6-year-old, who had a new family move in to the area. And one of the siblings made a comment about her skin color. And it made her very sad. She did not want to talk about it because she wasn't sure how to deal with it on her own. This is a 6-year-old we're talking about. And at my home visit with her, it was a well child check visit that I had with her. I always ask those deeper questions coming down to the end after I have done all the usual stuff and created a nice, environment where she opens up to me and talks to me about the usual things. Then I start asking her about school. Because typically when your parents pick you up from school, they say, "Hey, how was your day? What do kids say?" "It's all right." Or they'll say, "It was good." And then the parent will say, "Well, what did you do today?" Half the kids I don't know, I can't remember, right? But, and it's not to say that parents don't have the time to sit down and talk to their kids. It's that I get to fill that gap for them. And I get to ask some more direct, detailed questions. So I started asking her specific questions about the kids in her class. And has anyone ever said anything to you that hurt your feelings? Has anyone ever touched you in a way that made you feel uncomfortable? I really asked those deep questions. And that was when I found out about the racial comment that was made to her and how it affected her. And then I talked to her parents about it, and we all sat down together and talked about it. And it helped a little 6-year-old. And you're thinking, why is my 6-year-old having to deal with this right now? Well, this is the social environment that we're in right now, and it's best that we deal with it and talk about it early than, having her build up a whole bunch of negative feelings towards this one child. And that could then turn out into physical um, actions towards the child later on, and so being there with them allowed me to bring that issue out. And I felt like I accomplished so much that day.
How do you feel, or how do the parents feel? Do they ever tell you, boy, this is so different from the old system? Do they give you any comparisons?
Yeah, the number one thing parents always talk about is the amount of time that they get to discuss their concerns. They always feel like they're being rushed. And, typically with the old system, insurance companies direct you as to how many issues or problems you could talk about in one visit, right? And then you have maybe 10 to 15 minutes per patient. And most of the parents, they leave the doctor's office feeling like they did not that they were not heard, not understood, or that they just simply didn't get to discuss what they wanted to talk about. And so that's the number one thing I hear. I always hear, oh my gosh, Dr. Ross, I can't believe I got all this time to talk to you. So you answered all my questions. I can now do this. I feel way more comfortable. So being able to offer 30 to 60-minute long appointments, we would never have been able to do that with the old system. This new system is heaven sent for me too, because I really enjoy it.
Who doesn't want a happy doctor?
Right.
Something that just popped into my head, and that is that there's a feeling among, I guess, some parents that when they go to their children's pediatrician and they're looking for, they want something like a prescription or something. Do you find that they don't feel quite the pressure of, or if I don't get a prescription, I don't feel like I've gotten my money's worth?
Yeah, that's right. You're absolutely right. People just want to be heard. People also want to understand. And with the DPC model, the time that I get to sit down and sometimes even go to the drawing board and explain why your child has a viral cold, why it does not require an antibiotic, why antibiotics can make things worse if your symptoms are being caused by a virus. We don't get that time in the old system. But when I get to be there in their home and explain it to them, sit down, draw it out, and talk to them, because you also learn the parents. You're not only learning the kids. I'm not just there to learn about the kids. I'm also learning about the parents. I'm also learning the way that they understand things. So sometimes I tweak the way that I say things. I may talk more to one parent. I may draw more to another parent. I may even have to show a small little clip or a video to another parent to get them to understand. You can't do that in a typical traditional pediatric clinic. You just don't have the time. You don't have the capability, and so just there spending that time educating them on their level and in the way that they will understand it, they know that they got their money's worth.
Yeah. How long have you been a pediatrician?
5 years.
5 years.
5 years. And I'm glad that you brought that up, because it took me 3 years to want something different.
Wow.
And I think about all my other colleagues that have been doing this for so long, in the same old system, doing it the same old way and being unhappy. And I just could not stay unhappy for so long. And so I am so blessed to have found DPC and be able to make this change in my life as a pediatrician, which then reflects in the way that I practice medicine. And my patients, they just love me more for it.
They appreciate you far more. Yeah, I see that one coming a mile away. So even in your 5 years as a pediatrician, I make this point often enough that over the last 20 years alone, medicine has changed so much. And now within the last 5, genome is now down to the primary care level. So medicine's been personalized. If you don't have the time, there's no way you're going to handle it. There's just no way. I mean, change my mind. Am I wrong?
It's a numbers game. And so if I had 3,000-4,000 patients, there is no way I can give this type of personalized, intimate, quality care to my patients. And so I rather have a smaller patient panel, offer great care, than have a larger patient panel and make a ton of money. I mean, don't get me wrong, I'm not saying that I don't want the money, because I deserve to get paid for what I do.
Absolutely.
But I hate the feeling of being unhappy when I get home, knowing that I didn't tell this parent that they need to make sure that when they give the baby a bath, the temperature is at a certain degree. You know, I don't want to feel like I left out all these important things that's going to help them to be great parents, to raise great kids, and to not end up in the emergency rooms and in the urgent care. And so this is what makes the difference, is it's the numbers. And DPC allows us to have a smaller patient panel and to be able to give that great care and feel great about it at the end of the day.
You're also preventing problems in that, especially financial stress. The fact that you are available you're far more accessible than the corporate or the old system. You know, kids are kids. I know. I know what that was like. I know, Dad. I have an owie. It's a big one. So they're not going to the urgent care. They're going to see you.
Right.
And then, but the first call is to you.
Yes.
Which makes it so much easier because you can say, send me a photo, right? I mean, what are some of the things? Is there an example of that you've had recently?
Oh, absolutely. And parents love that. They love that they don't have to call the front desk, who then sends a message to the nurse, who then sends a message to the doctor, who then has to wait for the doctor to reply and then call you back. They love the fact that when they make that phone call or they send that text message, I am the one replying. I am the one emailing them back. I'm the one replying to that text or calling them back. They love that. And so the other day I had a mom of a 3-year-old. She messaged me and she said, Dr. Ross, I have a concern. Can I please see you today? And I said, sure. How about 10 o'clock? She sent that message around 7 in the morning. And I said, sure. How about 10 o'clock? And then I realized I could see her a little earlier. I said, how about 8 o'clock? She said, even better. She was so happy. And it was a simple situation about constipation, but she was so concerned about her baby. Now, guess what? While we were having the conversation, the child had a bowel movement. But just the fact that she was able to have that quick conversation with me, she went from, you could see it in her body. She was so uptight, so nervous. And then by the time we were done, she was relaxed. She was so calm about it. She knew what to continue to do if it happened again. And she said, oh, I'm so happy for this. I'm so relieved, Dr. Ross. Another example, I had a mom send me a picture of a rash on her newborn baby. And she was freaking out about the rash. And it turned out to be erythema toxicum, which is very harmless, very common in newborns. And it just made her day because she spent the night crying about it, thinking that something was seriously wrong. But then when she messaged me in the morning, just getting that quick reply within 5 minutes just made her day and made her feel like, oh, I knew I should have texted you the night before, but you know, she felt bad about waking me up. But I told her, like, this is what I'm here for. I'm here for you like this, you know, so that you don't spend the night crying. I want you to be comfortable when you care for your baby, you know, so they love it.
for a pregnant couple, when's the best time for them to sit down with you, go through it, and then to start?
Oh, as soon as they decide that they want what I offer, as soon as they decide. I actually enjoy this part of my practice. Um, so I typically would want them to come see me way before the baby is born. And I get to do something a little bit differently than your traditional pediatrician will be able to do. I like to talk to them about setting up their nursery. I like to talk to them about the baby registry. Like I like to go through items with them and show them what is good, what's not good, what's not necessary. That's the fun part of the practice for me. I get to make them feel incredibly comfortable before the baby comes. And so that's usually the time that I prefer that they come talk to me, and we'll do all the paperwork. Because the truth is, when the baby comes, I don't want to stress them out with any paperwork. So I try to get all of that done before. And so that when the baby arrives, it's just me, the baby, and the parents, and we get to focus on the baby.
Honey, we got this. Don't worry. I love it. I mean, so many parents will listen to that and go, oh, yeah, where do I sign up? What surprised you the most about direct primary care so far?
Wow. I think I thought that I had to invent this, you know, and it's great when you have an idea that you love so much and you're passionate about it, and then you realize how many other people also love the idea. And I think that's what surprised me the most, is that patients actually see the value in this type of model. They see the value in the quality care that they get through this model. And I was very nervous about it at first, but I'm just so happy that they want it so much. It almost seems as if the population has been yearning for this. They just didn't know how to articulate it or how to find it. And now we're able to do this for them.
What would you say to a room full of your peers, doctors who are in the old system right now?
I just want them to know that DPC exists and it makes sense. And it does not only make sense for the patient, it makes sense for you, the individual physician. We can be happy, we can care for our families. And I really wish that they would give it a try, or just look into it a little bit more. And let's really keep our patients happy and keep our own families happy.
Yeah. Happy doctor, happy patient.
Hmm?
Dr. Dionne Ross, thanks for joining me today. It's been a pleasure.
Thank you. It was my pleasure.
For Winning Healthcare Food Fights, this is Hunter Schultz. Stay healthy, wash your hands a lot, and there you are.